good evening if you're in South Asia. I wish we were gathering in better circumstances. My name is Ben Hopkins. I'm the director of the Sigur Center. I know many of you, both on the panel and many of you that I'm seeing your names on the screen in front of me. We're gathered today to have a discussion about the second wave that's presently got India deep in its grips, and to hear an on-the-ground perspective about what's going on there from a number of our own alumni, many of whom I've taught and interacted with, as have Kavita and Deepa. This is really an informal opportunity for us to chat and hear what's going on. So I'm sure there's going to be lots of interaction. In terms of ground rules, if you have questions, comments, or anything like that, please either raise your hand or also feel free to put them in the chat. I also need to acknowledge and thank my colleagues Deepa and Kavita for putting this together. Kavita sent an email to Deepa and I at the beginning of this week, which I really think reflects the heartbreak that we all feel looking at the situation in India, saying we've got to do something, we need to talk about this. And so that's really the origins of this panel. So I'm glad we can gather together for this, and I look forward to hearing that on-the-ground perspective and really just sharing our thoughts and prayers to everyone who's going through this in India now. So I'll turn it over to Deepa and Kavita.
Good morning, everybody, and good evening or good day. I too wish so much that we were meeting under happier circumstances. But I think, as we go through this crisis and see the unfolding tragedy, sometimes it is a good time for everyone to get together and have a conversation about this. Many of us have close family and friends in India, and so we're all extremely concerned, a lot of emotion, taking a lot of emotional toll on many of us. And when I understood that we were able to hold a conversation with our very own alumnus, young alumni who are sitting in India, Kavita and I just jumped at the chance to do that because, nothing like, for instance, even for our own students to hear peer-to-peer conversations, I think are really valuable. And I want to we're going to have a time period in the beginning where we will have the 4 alumni. I keep wanting to call them students because most of them were my students and I know them quite well in that way, but they have gone on from that role. And we're going to give them the opportunity to respond to a number of questions that Professor Kavita and I have put together. And I want to introduce them first before we go forward. But before I do that, and before we get to the actual event, I understand that Dean Wallbach is here. And so perhaps he'd like to say a quick word.
Hi, thank you, Deepa, and thank you, Kavita. When I saw the subject of this event, this panel, I thought this is so important for what we are grappling with as a world right now. And, certainly our hearts go out to everyone who's, whether in the United States or in other countries like India, who are suffering from COVID and the effects of COVID. And so just the news that I'm reading from India make this such a salient moment. And when I think about the college, our signature line is we're the engaged liberal arts. And part of being the engaged liberal arts is being engaged in the world and trying to make a difference in the world, including as our fellow world citizens in India are grappling with real crisis related from COVID. So as Ben said earlier, our hearts and prayers go out to all those affected, and thank you all for participating today. I'm very grateful to be part of this discussion.
Thank you very much, Dean Wallbach. And I should note that the Elliott School Dean Alyssa Ayers may be able to pop in, but she's she wanted to send her best wishes to all of you and may be able to join us. But all right, now on to the reason that we're here with these 4 youngsters from India. Let me start by saying that the way we're going to do this is that there'll be 3 different sections of topics that we wanted to, as a guide to the discussion, that Kavita and I will lead. And so we'll start off with one section, which is looking at the reality on the ground, get their perspectives on that. And then what we here can do to help, because many of us are feeling quite helpless, frankly, watching what's unfolding. And then looking a little bit more at policy, national, and then because we're in the School of International Affairs here, many of you have graduated from Elliott School, to see your perspectives on India, implications for India's international role. And to do that, we have got Thanvi Banerjee, who graduated from the Elliott School in 2019, as did several others. I did everyone else except for Akshaya, with the bachelor's degree. She double majored in Asia and international development. And right now she works in a really excellent educational institution called the Pratham Foundation, has done extremely good work in that. She was my research assistant for Rising Powers Initiative. She's absolutely delightful. The others are Rahul Bhatia, who graduated in 2019 with a master's. So he's sort of the senior guy in the group, and he has gone on to do very well at the Carnegie Endowment for International Peace in India. He's the Security Studies Program Coordinator and a research associate there. We then have Vaibhav Jain, who's also a 2019 graduate. He is in Economics and International Affairs and undergraduate, and he's a supply chain manager with a leading steel company. So that's where all the action is, with supply chains, as we all know from the news. And he's also involved as the director of a policy initiative called Young India, which is a DC-based progressive diaspora group. And I know he's done some work on what the US should be doing to help India in this crisis as well. And last but not least, we have Akshaya Sadras, who is coming to us from, not from Delhi or the surrounding areas as the others, but from much deeper south in Andhra Pradesh, and where she graduated in 2018 from the Elliott School, and she is currently doing a law degree as well as working in her family law practice. So we are going to get perspectives from a variety of locations. And I'm going to start by asking a very basic question, and that is, what is the reality on the ground? What is the most urgent thing from your perch happening on the ground right now with respect to just basic things like COVID patient and their sufferings, shortages of medicines, healthcare workers, vaccine availability, and what are the things that you really want us to know about? What are you seeing? And what are you feeling looking at this? Because you're experiencing them firsthand. Tanvi, I'm going to start with you, and then I'm going to give each of you, a couple of minutes each to respond. So Tanvi, and then Rahul, Vaibhav, and Akshaya. Okay. Thank you again so much for taking the time to do this.
Thank you so much, Professor. Thank you, everybody, for having me here. As you all probably know, the situation in India is abysmal. People are dying every day, every minute, and it is because of a lot of just a lack of resources in general. If you're looking for oxygen cylinders, they're not there. If you're looking for beds, they're not there. If you're lucky to find a hospital bed, chances are that you're probably going to die at a hospital because of the lack of oxygen. So there's no winning unless we get help, right? And one thing, Professor, I know a lot of my other panelists will be talking about this, but one thing that my experience has been over the last 4 weeks, since that's when this pandemic really took over Delhi, is the distinct lack of dignity in life as well as in death. So yes, the patients are suffering, they're gasping for breath, they're asking doctors, hospitals to treat them. But I think what is harder is the fact that what happens to the corpses after they die. So in a lot of cases, crematoriums are being forced to overwork. There's not enough space in graveyards to bury the dead. And I think Vaibhav can attest to this. One of our friends had recently reached out to us regarding one of his close relatives who wanted to donate her body and harvest the organs, right, for the students and medical professionals. Unfortunately, that did not take place. Not only because the medical students are not coming to the hospitals, they are not studying, they're not taking practicals, but also because of the fact that the morgues are full. So there is no space to keep cadavers for medical students anymore, just simply because of the fact that so many people are dying. So I think this was one of the examples of how harrowing it has been to just not only understand how life is being treated in India at this moment, but also how even after death, there is very little that you can do and very little autonomy that you have over how things go. And I think one of the other scary things that has been happening right now on the ground is the fact that COVID is reaching people in villages. A lot of people had earlier extrapolated that COVID had passed over rural India in its previous wave. Unfortunately, that's not the case. And in Indian villages, the community is very tight knit, right? So there's a lot of stigma of getting COVID, having to quarantine, not being able to be with the family. So in turn, what is happening is that a lot of people are not telling people that they have COVID. A lot of my colleagues who work on the field have had to convince their parents to get a COVID test, which again is not widely available. So even if you do manage to get a test, chances are you're not telling the people that you meet every day that you have COVID, which in turn is leading to a massive, massive loss of life just because of ignorance and a lot of fake news also. So again, very grim, and we're just trying and staying positive as much as we can. Yeah, that's it from my end. Professor, I don't think we can hear you.
Sorry, I unmuted myself. Unmuted myself. I just said that you are located just outside of Delhi in a fairly large suburb, Gurgaon, right?
Yeah.
So that's what you're seeing there. Okay. And next, Rahul, you're also in Delhi. I don't know exactly which part of Delhi.
So I'm right at the border of Delhi and Gurgaon.
Okay.
So similar locality, I guess. But first of all, thank you for having me. It's always nice to come back. But I would say what Thanvi has said is quite accurate. The biggest rather impediment we're facing right now is the shortage of oxygen. Many states have been sort of almost crying for more oxygen supplies. And the problem is India is not the production of oxygen, it's essentially the logistics of getting it from the factories to the cities and the hospitals in them. So just to give you an example, Delhi needs ideally about, sorry, 700 metric tons of oxygen. But over the last week, they've only received about 400 metric tons. And only yesterday, I think, was the first time they received more than 700. So in this interim period, the Delhi government is trying to obviously distribute the oxygen to these various hospitals, but it's not enough. So they're issuing SOS calls almost every day saying, we only have 2 hours of oxygen left or 1 hour of oxygen left, right? So this is definitely the largest issue we're facing. Another issue is, of course, the shortage of healthcare workers. A lot of them are testing positive and having to not, or rather not being able to work. So there's a shortage of medical staff as well as oxygen. Another thing to note is that neither the central Indian government nor the states really prepared for a second wave. So it's kind of taken them by surprise. or rather they didn't expect it to be such a large wave. So in a sense, for me personally, I've been very fortunate. No one in my family has tested positive. But at the same time, you live under this fear that you just hope that all the precautions you're taking will pay off and nothing will happen to you or your family, because you know that if your family requires medical attention, even something as similar as simple as oxygen, it's going to be very difficult to get it.
Yeah, I know that in some cities, the lockdown, is it different timings for different cities, or is it pretty much a national? Do you know?
So it's a combination of localized lockdowns. For instance, Delhi has first imposed a week-long lockdown, which was renewed twice. The state of Kerala is going to go into lockdown from Saturday. Karnataka is already in lockdown. Uttar Pradesh imposed a weekend lockdown. So it's varying combinations, but there hasn't been a single national lockdown like there was during the first wave.
Right. Vaibhav, you want to chime in here?
First of all, thank you for having me, Professor. I wish it was under better circumstances. But my friends here have painted a very detailed picture of what's going on. I'll add a few tidbits. In terms of the oxygen shortage, that is a very real struggle, even in the national capital, like Rahul mentioned. I mean, Delhi's requirement is well over 700 metric tons. We've been getting half that. Only yesterday did we get, were we able to have our full requirement met. But that's just the 790 metric tons is just the hospital requirement. There are a lot of patients who are being treated at their home, and they also require oxygen. They require oxygen cylinders to transport that oxygen in smaller quantities. Even they are under short supply. And we require oxygen concentrators, which are selling in the black market for 2x or 3x the list price. And just today, a big racket was busted in Khan Market, which is one of the most prominent neighborhoods in Delhi. And it's not just the oxygen shortage. The other piece of it is continuous medical education. That's a thing which India has struggled with forever. It's a systemic issue. The AIMS, which is the All India Institute of Medical Sciences, the premier hospital and institution which kind of sets all these treatment protocols along with the ICMR, which is the Indian Council for Medical Research. These two institutes, they still have HCQ, hydroxychloroquine, as a part of their treatment protocol for moderate diseases and moderate COVID-19. And HCQ was ruled out last year, but doctors, they still continue to prescribe it. And similarly, people are just popping steroids even when they don't need to. That's why steroids is off the market. Paracetamol is in short supply. Remdesivir, which is an antiviral injection, which should only be taken under a nurse's supervision, if not a physician's supervision, because it can have some cardiac implications. People are just taking them at the pharmacies. It's a mess. And similarly, oxygen is also being overprescribed. People who don't need oxygen are taking oxygen, and then because condensed oxygen is dry, it dries their lungs and it adds other complications to their case. So those things are also being noticed. And obviously, vaccines are in short supply, and that doesn't even begin to describe it. After the pandemic really took off, we are now vaccinating about half of what we were doing before the peak happened. So before the peak, we were doing about 4.5 million vaccinations per day. Nationally, now we are down to 1.5 million. I think yesterday it was 1.4 million. And there really isn't any clarity on what the production pipeline is, on what the distribution pipeline is. So local centers, they kind of tell citizens about availability of vaccines almost on a daily basis. So there's also increased wastage because just nobody knows, and citizens can't plan. And there are long lines of kilometers long at vaccination centers, and there's a lot of transmission happening in those lines, which goes completely unchecked. And we were talking about just how overworked our healthcare workers are. I mean, they are beyond the point of exhaustion. I have doctor friends, I mean, who haven't seen their families for months just because they don't want to get them sick. So they're quarantining in different flats, or, some of them have gone to hotels, those who can afford it. And just to throw some statistics out there, India has 1.34 doctors per 1,000 patients. And that's that's when things are going good. Right now, a lot of doctors are under stress because they are sick, their family members are sick, so they have to kind of go away from their duties. We have only 1.7 nurses for 1,000 patients. We have 2.5 ventilators for 100,000 patients. That's how bad the situation is. So if you venture out outside of Delhi, I mean, if you just go east, go to Uttar Pradesh, which is India's largest state in terms of population, and it is a mess. People are literally dying like flies. I wish there was a more dignified way of putting it, but that's actually what's happening.
Thank you. That is such a, you're painting a really a dire picture here. And thank you for such detail, because it's obviously not easy to be in this situation and even talk about this, but and to have a black market in the middle of this is really disheartening, I must say. But let me just move quickly to Akshaya, who you mentioned, Vaibhav, that other parts of India. Well, here we have someone who's sitting in Andhra Pradesh in the south, so, and in a mid-sized city, right? So, Akshaya, what has your experience been?
Thank you, Professor. I think compared to last year, the first wave, towns compared to cities were faring relatively better. People were still getting treatment, they were recovering, and the situation wasn't as serious as in the cities. But this second wave, it's just been almost, the same issues as all my panelists mentioned. There's been a lack of oxygen, there are no hospital beds, there is a severe vaccine shortage. And I think the very serious situation is the rural population. We just don't get any information in the media or the news from the rural population. Like Thanvi mentioned, they don't want to go get tested. Not that there are any, a lot of tests, but they are just staying at home even if they have symptoms, because there is this taboo or the stigma of being COVID positive. There have been instances where, if they are COVID positive, the whole family has been thrown out of the village. So they're very scared to go out and get treatment. And there is a lack of awareness. It took a long time for them to understand social distancing and masks. And so by the time they got there, it's already spread for the second wave. There are a lot of people dying in villages. We hear it every day, but we don't see the numbers in the news. And I think that's pretty dangerous, because the reports are not showing accurate statistics. And if you just think about the villages around my town and this, there is a huge Indian rural population. So I think even when we're getting aid from other countries, they are just basing it on what they see in the news and not the actual numbers. That's very dangerous. And another thing is this emergence of a black market. The oxygen tanks are being hoarded by people who don't really need them. They're just worried that if they get COVID in the future, they'll need oxygen. So they're just keeping it at home, and hospitals are not having it. As well as medicine, the medicine that Vaibhav mentioned, the antiviral injection, it went from $40 to $200. And people are stealing from pharmacies and selling it outside to people who need it for exorbitant amounts. So that's another issue that we're facing here. And there is no regulation in towns. There's less regulation in towns when compared to cities, I think. So people are able to get away with these things much easier than they are able to in the cities. That's the perspective from.
Okay, what a straight kind of information, because we don't hear this kind of stuff in the media. And that brings me to something that we wanted to ask, and I'm going to turn it over to Kavita in a minute, but just very quickly, one question that we had was, how do you rate the media coverage of this whole unfolding of this crisis? Is the media missing something? What would you like them to say more on? And are you even watching the media now these days? Do you have time to do that? Are people watching anything? Yeah, Tanvi, let me just get back to you on that. And we'll just go around very quickly if you could, and then I'll turn it over to Kavita.
I think, as a lot of people already know in this call, the Indian media is very polarized on a very broad ideological spectrum. So a lot of the mainstream media also tends to favor a sort of right-leaning political ideology or a left-leaning political ideology, and that does inform the narratives about what gets reported in the media, right? Especially in certain states where the opposition or the party in power, is calling the shots. I think one of the main things that the media needs to do, irrespective of the political ideology, which they are trying to, they're not all there, but they're trying to, is that they need to hold people in power accountable. Not just people at the center, not just people at the state, but I'm talking about your local MLAs. I'm talking about your local panchayats. Hold everyone accountable, because the citizen has the right to get access to the resources that they have paid for with their taxes, and the government has a duty. The other thing that I wanted to address was the huge lack of transparency and fact checking. So I think fact checking has to be one of the biggest things that the media can do at this moment. There's a lot of fake news being circulated, a lot of I would say a lot of crap, for a lack of a better word. And a lot of people do receive news online these days. So a lot of people tend to get news from online publications, from social media channels. And it is upon the media, the reputed mainstream media, to inform people that what they're seeing is accurate, that they need to be, that their own reporting needs to be based on facts and figures, rather than any political motivations or any other such interferences.
Okay, we have, I'm just going to let any of the other three, would you like to add anything to that? Is there anything that's missing that you would like the media to highlight, for example? What more would you like to hear from them? Anybody else? I'm just going to ask. Yeah, Rahul, if you have something. Or
I just wanted to add one point to what Tanvi already mentioned, is that if you were to switch on an Indian news channel, regardless of which one it is, a national Indian news channel, and if you were to compare what they show you to a BBC or a CNN International, you'll find that the images and the videos that are displayed on BBC or CNN are far more dynamic and impactful than those displayed on the Indian news channels. I'm not entirely sure why this is the case, but it does sort of reflect that maybe they're not covering the pandemic to the extent that they should be. Another thing that I did want to just add on to what Tanvi said is that the media sort of needs to, I'm talking about only television media, needs to step up and sort of shed more light on the gaps in India's response to the second wave, so that awareness can be generated about these issues and they can be resolved much quicker.
Okay. Anybody else? Akshaya or?
I just want to add a quick point, Professor. I think, Tanvi and Rahul, they kind of talked about the national media versus the international media. But I think one beacon of hope throughout this crisis has been the regional media.
Mm-hmm.
They have been very proactively covering this, whether it is in print or in TV news, and they have really been holding powerful people to account. So that's one, huge beacon of hope here.
Would you say that that's true across the board, or are you talking about
Yes.
specific regions?
Including the Hindi media. I think all the other regions anyways have always had a very robust media, but the Hindi mainstream was being tamed over the last few decades. That this crisis has shattered that.
Okay, yeah, that's very good, because I do know about the South, that the media is much more, they hold them to account much more. Okay, I'm happy to now turn it over. We have so many questions, and I know there are questions in the people who are in the audience. We will have a chance in the end for you to ask questions as well, and you can simply raise your hand at that point and jump in. So over to you, Kavita, for more questions.
Great. Thanks, Deepa. And I just want to thank Kajal Joshi, award-winning Elliott School alum who, connected all of us and supported creating this conversation. So thanks for being here, Kajal, and hope to loop you into the conversation later. I want to go to the next question, which was about, can you give us a sense of how is help being organized in your particular city? So, are there, in terms of what's happening on the ground, is the help or support coming primarily from the government, from NGOs, or from just neighborhood community organizations? If you could give us a sense of that in terms of what kind of help is being given and who is giving it. And then if you could maybe also reflect on, from your perspective, do you see any models in terms of, what is working and what has been successful in terms of ameliorating the crisis or the experience of people in the crisis? So I think we can start with Akshaya.
Thank you, Professor. I think in this case of a small town, it's been a lot through word of mouth. There's not because, the rural populations, they don't use a lot of social media. So, we have calls coming in every day asking if there's a hospital bed available, or if they know anybody who has oxygen. So I think that's one way that people have been helping. Local communities have been really banding together to help. Another thing is people have been coming together to financially donate to low-income groups in the surrounding villages. If they hear of anybody losing their jobs, they're helping them in this time, because there are a lot of daily wage workers who are not able to come to the towns to work every day because of the curfew or because of COVID. So they're supporting them during this time. Another thing is that a huge thing is creating awareness. So people have been going into villages and giving out free masks and free sanitizers and just kind of telling everybody to wear them and how to socially distance and why they need to do it. And as Vaibhav mentioned, print media is a huge resource for us, because we don't have social media a lot there. So people are reading newspapers and getting information from that, and local channels like town channels are spreading awareness about it. So I think here local communities have been a big deal, but I also see NGOs kind of trickling into the rural populations right now. I know they are doing a lot in the big cities, but slowly they've been coming in for giving free meals and helping orphanages and stuff. So that's something.
Great, thank you, Akshaya. It's interesting to know how it's playing out in Rajahmundry in a very different way. So thank you for sharing that. Vaibhav, would you reflect on what you're seeing on the ground?
Yes, I think one sad reality, it has a good side too that I'm kind of seeing around, is that the citizen-state contract has completely broken down, and it has been sort of replaced by medieval networks of family connections and caste. People are leaning lots more on their caste networks to sort of source oxygen cylinders, to source beds, for medicines, and similarly for connections. I mean, if you know so-and-so, you can probably get a bed. And same with family. I mean, there's no state support structure. So somebody falls sick, the entire family has to go out. One person is getting the medicines, one is on oxygen, one is going from one hospital to another looking for a bed. The state is completely broken down. So it's the family kind of stepping in. The other is just within Delhi. I live close to a Sikh neighborhood called Tilak Nagar, and there are lots and lots of oxygen langars are being organized. So because oxygen is in short supply, the Sikh community has put out these public oxygen cylinders on the streets. So people who are suffering and are otherwise unable to arrange oxygen, they can just go there and sit there for a while and get some oxygen while a more permanent arrangement is arranged by the Gurdwara. So that's an interesting thing that has also come up. Besides that, there are tons of NGOs working in Delhi, trying to support daily wage laborers that who've lost their job. There are agencies that are trying to support migrant laborers who are again walking back home, who are again taking these trains and buses home. But it's not enough. The state needs to do more.
Thank you, Vaibhav, and I appreciate you highlighting the way in which the Sikh community and the Gurdwaras have really stepped up to this challenge and organize and help. So thank you for reminding us about that. Rahul, what are you seeing on the ground?
I mean, I would just like to add a couple of things. So first is that NGOs have also been pitching in by helping cremating people. A lot of crematoriums are now run by NGOs, and they are organizing, for instance, if there was a COVID death in a family, they're even going up and picking up the person and conducting the cremation rituals, all with the COVID protocol. So that's an important factor. Another one is, of course, there are some NGOs which have started these door-to-door delivery of medical oxygen, and also setting up makeshift shelters for people to come and take oxygen as well.
Great, thank you. Thanvi?
I think most of the panelists have already covered this, but I just wanted to highlight some of the more vulnerable communities that often get overlooked and fall through the cracks. So I think one of the main communities that is of interest to me professionally is children, right? Nobody thinks about them, what happens when they're orphaned, what happens if both parents die, who steps in. So I think there are a lot of informal, again, the caste family dynamic has come to play. But again, there are concerns about human trafficking, there are concerns about child trafficking and the child's overall well-being. So in some cases, we have started seeing the state slowly thinking about creating public policies that support aiding orphan children, right? So there has been some thought about it. There has been some work around that. The other community that I'm thinking about is the transgender community. So a lot of their work revolves, if people don't know this, a lot of their work revolves around going to weddings and auspicious occasions. And since none of that is happening, and they have been stigmatized and ostracized, they have been begging for food. People are not there to help them out, right? So who helps them out in these cases but an active civil society? And I'm actually very glad that in India we have a fairly active LGBTQI civil society that is shaping up and is taking charge. So these are some two things that I wanted to highlight.
Great, thank you. I appreciate how all of these remarks have highlighted the way in which class difference, age, sexual identity have really shaped and complicated the lived experience of this crisis. So thank you for alerting us to the nuances of these various dimensions. My next question is really a question that I think almost everyone in this room is asking, which is about, how can we help? We are all devastated to see what is unfolding in India. And so, what would be your perspective on how those of us who are in the United States can make a difference and can help? Would you recommend, donating to specific organizations as being the primary and most useful way that we can make an impact? Or are there other ways in which you would like to see, your members of the GW community, as well as people in the United States, helping or trying to make a difference and contributing to, alleviating this crisis? Sorry, we'll go in the same order. So Akshaya?
Yes, Professor. I think there are a lot of organizations that have come up who are doing like a very good job, procuring resources and kind of distributing them. So, and I think links have been provided. So, just take a look at all of them and see where they're going and how effective they are. Do a little research before donating to these, organizations. I think that's one thing that would be very helpful. Another thing is just kind of taking a cue from what's happening here and just, personally just being careful there as well. I think what happened was in January, February, we all relaxed and everybody started going out and, because we heard the vaccine was coming. So it started spreading again. One of the factors was that. So taking a cue from that and being careful and still wearing masks and socially distancing. So the same thing doesn't happen there.
Thank you. Vaibhav, how do you think we can help from here?
Yes, I think, Professor, donating obviously at our individual level, that's the easiest thing we can do, and that's the most important thing right now, given the humanitarian costs of this crisis. But more medium to long term, I think there are things to be done domestically, and there are things to be done which Americans can do for India. So, for instance, when the AIDS epidemic struck in the 90s, after that, a Pepfar Fund was established, which was the President's emergency plan for AIDS relief. And this fund, essentially what it did was, so between countries, you can fix vaccine and therapeutic inequity between countries, but then there are inequities within countries. And a presidential or a congressional fund could partner directly with state governments, with NGOs, local and international, and ensure that people of certain classes that are discriminated against, or poorer folks, or people discriminated on the basis of gender, all of those people also get access to those things. And a presidential or a congressional fund, people can advocate for that. GW students can advocate that for on the Hill and elsewhere, reaching out to their congressmen and congresswomen. Domestically, I think we should all take a cue, and this is going to sound absurd, but we should destroy the pharma lobby. The high cost of insulin in America, it's just preposterous. I know the TRIPS waiver has been supported by the US, has also now been EU, but Germany and others are holding out. I think we need to go a little beyond that, because the waiver, even if it fully kicks in, there's going to be a latency period of 6 to 8 months before the increased vaccine production can kick in. So in that interim, America needs to be doing more. They need to be exporting more of these vaccines, because I'm hearing lots and lots of stories of unused vaccines going to waste. So we can fix those things, and that can happen domestically.
Right. Thank you. Excellent point. Rahul?
I would just like to add, or rather reiterate, that please do donate if you can, but also please do your research before donating and make sure that the money that you are giving so generously is reaching those who actually need it. The other thing I would like to mention is that, yes, the second wave is India's problem, but it's also has global implications, because the longer the pandemic goes on, the more chance of new strains coming up. And if by chance there's one that is vaccine resistant, the whole point of this is lost. So I think it's important to spread awareness and ensure that even after this initial tranche of aid, that the United States continues to assist India in fighting the pandemic.
Yes, thank you. That's a very important point as well. Thanvi?
Yeah, I think I'm just going to reiterate what everyone else already said. Please donate responsibly, do your due diligence. I think I'm just going to try and send this link. I verified this. This is from a very reputed organization called Center for Policy Research in India. They have compiled a list of resources. You can take a look at this. One more thing that I do want to highlight is if you are reaching out to your families and friends in India, if you want to help them find information for oxygen, hospital beds, etc., a pro tip: first verify them yourself before forwarding them to your loved ones, because everyone is inundated with a lot of information, right? They simply do not have the time to call each and every number. What you can do for them is you call it first, tell the person if it works or not. If it doesn't, then don't waste their time. I think that way you can streamline and get the right help that the person needs almost immediately to them, right? So I think these are the two things that I wanted to highlight.
Great, thank you. Deepa, we're of course running, behind schedule. So did you want to maybe ask a last question or two before we try to have a Q&A and squeeze that in?
I think let's try that very quickly. I want to actually thank you all for this amazing information that you're letting us, giving us up to date on. But I wanted to, if you could, as all of you are students of international affairs and with the Elliott School, I would like to step back from the everyday, the immediate trials and tribulations that we've been hearing, and ask how you think given your own studies and so forth, how you believe this crisis is impacting India's reputation internationally. You know, the mishandling of the COVID crisis that turned India as an object of pity right now. And do you worry about, or do you think about India's ability to regain its international standing? You know, we were talking about India as a rising power just a couple of years ago. And in this case, you know, for instance, the US-India partnership is very important in its rise. And COVID diplomacy was supposed to be a central part of this, especially this vaccine Maitri, where India with the Quad countries would be would produce up to 1 billion vaccines by 2020, and it would be the kind of a big soft diplomacy there. How do you view this? And so let me just start by asking Rahul, sitting at Carnegie. And
Thank you, Professor.
What do you think?
So I think there's, of course, a long-term answer and a short-term answer. The long-term, looking at the long-term, you can say that I do believe that India will continue to remain a country of great potential. And if it is able to course correct, it can once again establish itself as a rising or even a leading power in the world. That is still very much on the table. But this would depend mainly on how quickly we're able to revive our economy. And coming to the short term, I think the second wave and a potential third have significantly weakened India in terms of we may see a less ambitious Indian foreign policy in terms of, you know, I think Prime Minister Modi was quite ambitious in his first term and a little bit in the second term as well. But we may see a more conciliatory approach, at least in the neighborhood, or sorry, South Asia. And South Asia is a region that India is trying to maintain its influence in. And one can see that it will maybe adopt a softer tone towards its neighbors. But at the same time, I think it's also important to note that this second wave has seriously dented India's credentials to be a leading power. I mean, accepting aid after 17 years is definitely a step back. But I do believe that it can come out of this. In terms of the US-India strategic partnership, I feel that although there was an initial stutter from the Biden administration in terms of providing aid, just the amount of aid that has come from the State Department is phenomenal. I think it's about $100 million worth of aid, which far exceeds any other country. And it's not just the State Department, it's the private sector as well. Big tech companies are donating to India. So I think this is very well received in India, and the partnership will definitely continue to grow and deepen. And this is notwithstanding the strategic value both countries hold towards each other. So I think overall, no long-term consequences for the US-India strategic partnership, but some very real short-term consequences for Indian foreign policy, especially in South Asia.
Very well stated, Rahul. That idea of potential is, I think, very, very key as we move forward. I'm going to just very, very quickly, like 30 seconds from the rest of you. Tanvi, what do you say?
Yes, definitely. I think this has dented India's reputation for sure. I mean, we're asking for oxygen from Bhutan for the state of Assam, and the Punjab state government is asking to open a special corridor for oxygen between Pakistan and India. So obviously there is concerns over that. I think, as Rahul said, this is an example of what happens when a country does not align its soft power ambitions with its domestic realities. So that's a lesson for all of us. In a crisis, please do that. Please take a stock of what the situation is at home and then look outwards. I think I just want to say that, I think there is not going to be a big change in the US-India strategic partnership, just because of the fact that, there is, at the end of the day, a very aggressive China sitting right at our borders. And then there is also Russia, both of whom have been knocking on US's back door in Latin America and doing a lot of COVID vaccine diplomacy. So, I mean, at this point, if I think this sending India the aid that it deserves is a very strong statement of how this partnership can go on forward. Yeah.
I love the bringing together of domestic and international alignment. That's absolutely essential. Thank you, Thanvi. And now Akshay and Vaibhav, very, very quickly so we can get to some questions.
Sure, Professor. Just to reiterate, long term, I don't think that it's going to have there's not going to be a very large fall in India's status, but I think they can take a lesson from this and see how the infrastructure can be developed. So when we do have a crisis in the future, we don't have to resort to this. This is just a complete weakening of our image short term. And like Tanvi mentioned, this is just going to strengthen the U.S.-India partnership, all the vaccines, and I think they've slowly waiving the IP in the US. So that's a mark of significant relationship between US and India.
Thank you so much, Akshaya. Thank you. And Vaibhav, quick word from you.
Yes, Professor, I think the other panelists have already said all the important points that need to be covered. But the only thing that I will add, and I'm saying what I'm saying because I'm also very frustrated as an Indian right now, but I think we just need to quit our weird obsession with being a leading power when we can't fix basic governance structures at home. We really need to make the Indian state work for its last citizen. And till we do that, this leading power, superpower ambition, it just doesn't make sense.
Thank you for that cautionary note. And now we can turn to some questions. I will just say that, last year, the images in New York City were quite horrifying from a variety of, from when you look at it from anywhere. And they were talking about the US being a failing state or failed state. So this is, we've seen this before. Let's see if India, how quickly it gets out of this. So, okay. We can now turn to some questions. Thank you for your patience. And we can actually stay a few more minutes after the closing time in case people want to go on. So I'm so happy to see Kajal's hand up here. Kajal, welcome back. She was in my class and a star student.
And mine too. She was in my Bollywood cinema class too. Hi, Kajal.
She went from politics to Bollywood. Okay, well, I'm really looking forward to hearing your incisive question, I know, or your commentary. Tell us what you're thinking.
Thanks for mentioning both. Question-wise, my question, I guess, echoing sort of Vaibhav's statement, is that we're seeing this strategy both overtly by the Foreign Minister, Jaishankar, who seems to be laying the blame for India's public health crisis at the previous administration's door versus sending a message of taking accountability right now. And the BJP IT cell, which is flooding social media with graphics that there is only one Modi to deal with X% of population and X size of territory versus you look at similar territory across Europe or Latin America, and you have X number of prime ministers, presidents, etc., to deal with crisis at that kind of scale. Or you have social media graphics being circulated everywhere about how India's sort of death rate is not as high as compared to other countries, disregarding the fact that there's gross underreporting at every level that's going on. And in some cases, actually, data is being suppressed as part of a spin campaign, for lack of a nicer term to put it. So asking the professors and the panelists, from an IR perspective, how well does putting a Band-Aid on a dam really work when it comes to positioning your nation in global standing? How does trying to wish away or talk away a concern play in terms of global power structures and relationships? That's my question. And my commentary is related to, because I work in the social impact consulting space right now, in terms of which kinds of organizations you're looking to donate to. A lot of organizations that are donating from the US, especially ones those who are transparent, good examples of good fundraising drives that are going on are those by the American India Foundation or in diaspora right now in America. They are transparent about who they're giving to and who the end beneficiary is going to be. And honestly, just recommendation-wise, while most big philanthropy players are going to be if they're donating to the government, there's no guarantee it's going to get to people's hands. But if they're able to get it to the community, your money might see more impact on the ground. That's just my commentary there.
Kajal, as expected, you've asked a very probing question. I'm just going to say one word about it since it's in the field of IR. Frankly, I think that as a democratic rising power, the best thing that the leadership can do is to come clean on the failings, because I think that you need to have built trust, rebuild the trust internally, and project an image that you know the issues. There were shortfalls. We have to deal with it. But that's my take. Come clean. Otherwise, no one, credibility is a big problem. But what, Rahul, Thanvi, others, anything to respond to your colleague, Kajal?
If I may, Professor. So I agree with what you just said. I think it's ideal if the Indian government does come clean about how it has actually handled the pandemic. But at the same time, I think despite India's attempts at managing perceptions, I think no consulate or no embassy in New Delhi is is really biased. I would assume that everyone knows and what is actually going on in India, and I think the perception management sort of fails if you have the international media saying one thing and the Indian government saying another thing.
Okay, good point. You can't hide this behind
Professor,
some kind of.
just one quick point.
Mhm.
I think transparency also helps in improving operational efficiency. Right now, the left hand doesn't know what the right hand is doing. There are oximeters being imported by private corporations, good-hearted citizens from China, but they're all sitting at the airport at different custom officials. So we just need to have more transparency, a pipeline of what's coming in, what's going out, where it's at, how it's being distributed, just so that the right aid reaches the right people at the right time.
Before even that is too late. Yes, thank you. Very good point. Akshay, anything to add?
I think my panelists have answered the questions, Professor. I think transparency is very, very much needed. There's a lot of information coming in, like too much information, and it is really hard to know what is actually happening on the ground without talking to the people involved in the situation.
Okay.
Yeah, and I'll just jump in because I really want to thank Kajal for pointing out the way in which the state's response has been focusing more on the crisis as being a PR crisis instead of a humanitarian crisis, and the ways in which social media are being manipulated. We actually had a question about what you thought about social media, but maybe we'll hold on to that. But thank you, Kajal, for that nuanced observation about the contradictory media representations of this moment and how social media is being mobilized in very troubling and problematic ways by the state.
There's a question that is in chat that I see from Ryan Lee. And he's posting it to all the 4 panelists, whoever wants to take this. Thank you for being here today and speaking candidly about the situation in India. His question is whether you're seeing any deterioration in social order, or has the government ability to maintain social order remain intact? I mean, one would think that given the kind of chaotic scenes that you're seeing, that could be a precursor to something that is a kind of a breakdown of social order, communities, and so forth. I didn't hear that coming through from any of you. If not, what do you think is holding everything together?
Can I maybe pitch in?
Yeah, Thanvi, go ahead.
I would say in some states, yes, the law and order situation has gotten pretty bad. Not in the traditional sense of it going bad, right? You're having patients' families beating up doctors and healthcare front, and healthcare workers and the police not being able to control any of that. You've had doctors fleeing, refusing to treat COVID patients just because they fear retaliation. I think there is a lot of grief, a lot of trauma that is unprocessed. And in addition to that, you have a very corrupt, at times, local administration, which does nothing to add, if you have been a victim of some of medical malpractice, or if you are even a doctor who has been threatened by kins, in a lot of the cases, the machinery is not there to support you. So in that case, I think there is, in a very non-traditional way, the law and order situation is falling apart. So that's just one observation that I had on this.
Okay. I also, during the at the Serum Institute, there were people who were clamoring outside big protests for more vaccines for themselves, and so we saw that kind of protest going on as well. Any others on the social order? I mean, social orders can be sometimes very tenuous, but at the same time, there are reservoirs of strength there that we don't necessarily see.
I think people, they're taking advantage of the situation. They seem to be exploiting the population that are unaware of what's going on. We've had cases here where they're selling fake vaccines, fake medicines to the rural population. And there are people having, makeshift hospitals with people who are not real doctors, not real nurses, but they are charging exorbitant amounts for people to come in, and then they are not releasing the bodies to the family unless they pay them like 4 or 5 lakhs. So there's a lot of exploitation going on, and there is no oversight or regulation because the administration is caught up with what's happening with people who are sick and COVID. So there's no regulation. I think that's what's happening. On one hand, people are trying to help. On the other hand, there is a section of the population which is exploiting people. So that's very sad to see.
Okay.
Professor, if I could add a couple of quick things.
Yes, please.
I think, just to echo Akshaya's point, the breakdown is not happening at a macro level right now, but, there are individuals who are just taking advantage of the situation and profiteering in the worst possible manner. It just goes on to show their public spiritedness or lack thereof. And I think a lot of citizens, even the good Samaritans, have sort of realized that they cannot lean on the state for anything. The state is gone. It's themselves, their family, and their community. That's really it. So I think that sense has percolated down to everyone. And the second thing is, at a macro level, are we going to see a breakdown of social order? I think this was anticipated last year when, hundreds of thousands of migrants walked back to their home, and it was, sociologists talked about this being the largest exodus since the partition of India. And a lot of people expected some huge change to come out of it, but so far it hasn't. So my guess is perhaps it's just too early to tell. Once the tide has gone and 4 or 5 years have gone by, only then will we really know what kind of structures broke down and what new ones came in their place.
Thank you for all that very analytical answers to that really pretty tough question. I think Kajal, am I seeing your hand up again?
Yeah, I had just something quick to add here, that when we talk about social order, the concept of social order itself is being used as a weapon to suppress citizen angst and neglect by the state. You have a state government in Uttar Pradesh that's threatening to seize the property of citizens who tweet about an oxygen shortage in their area, saying that you are unintentionally causing a panic. There's no shortage, and if you do so, I will seize your property. You have governments that are actively there are stories floating around amongst political fixer communities with whom I unfortunately had to get in touch while trying to secure a bed for my grandmother, who's currently on a ventilator. That governments, there may be beds at hospitals, but hospitals aren't allowed to let them be available because the government wants to keep the death count down. You have crematoriums that are inundated, bodies that aren't going properly, but then the government is appealing for people's support through formal and informal channels, saying that please, if you don't support us, social order will break down. And we are trying to prevent social order from breaking down. So expressing dissatisfaction or dissent is slowly being equated to threatening the social order in this time of crisis, is something I wanted to point out.
Thank you so much, Kajal. We should always be aware that the idea of order itself is interpreted in very different ways, and that order can cut a number of different ways under an unscrupulous government. So thank you. We are actually well over our time, but I do want to take a minute to simply formally thank the panelists here before we break up. And we can stay on a few more minutes, but I want to acknowledge all four of you for the tremendous way in which you have participated and made such informative comments. And I have to say that our question from Kavita and I about what is the media missing, here we have the answer. You all have just provided what really needs to be told. These are the stories and material that we need to hear, and not just us, across India. So I think you have done an incredible service to all of us. We owe you a big debt. And I must say personally, on behalf of the Elliott School and GW, we are so proud of you. I'm so proud to say, we have this incredible group of alumni, and I know you're going to keep doing great things in the future. And I'm really looking forward to being in touch and knowing how your life goes. And of course, right now, India is a very resilient country. Indians are resilient, but I think what's happening is really testing that resiliency. And so all I can say is, let's hope that we get better news as we move on, and hopes and prayers are with you all. Okay, so that was just my formal thanks, but we can stay on because there might be others that have questions.
I would like to also